Hello, hello, hello. It is another Wellness Wednesday. I am coming to you live today from my office from Better Health Solutions. Running a little late today because I was out there actually changing lives just now. So I'm so excited to be before you today. Today is going to be a little bit different. I will not be dealing with a specific health topic. I am actually going to be dealing with a bigger issue. I want you to understand what naturopathic medicine is, what naturopathy is. First of all, a lot of people when they go to introduce me cannot say the word, and I always get such a kick out of that. But I want you to understand the difference between the natural health model and the medical model. So here goes. First of all, I'm a chiropractor licensed in the state of Georgia. Chiropractic philosophy is actually encompassed in naturopathic philosophy. And what we believe is we believe in the body's inherent ability to heal itself. So your body is so brilliant. There's an intelligence within you that was placed there by our Creator. And the body truly can heal when it's given the right tools and when it's unburdened from all of the toxicity and interference that we now face, which is at an all-time high, which is also why sickness and disease is at an all-time high. And so I got out of chiropractic school in 2006. I immediately started working with holistic doctors and just fell in love with a truly broad scope of healing, and found that now most of the people that I see actually have a chiropractor, and I work with a lot of the challenges that are just non-resolving, those chronic things that don't have good medical answers. So getting out in 2006, I started working with holistic doctors. I fell in love with clinical nutrition. And so I have done hundreds and hundreds of hours of postgraduate work on clinical nutrition, on naturopathy, went back to school, got board certified as a traditional naturopathic doctor. And I truly love what I do because I get to witness miracles every day. And I get to find things that are not commonly found on just regular medical tests. So basically, naturopathy, as I said, respects the ability of the body to heal. And there are, in terms of the way that differs from traditional medicine, in traditional medical model, which is what we're most commonly familiar with, it's like this. If this is wellness and this is sickness, there's a very defining line, okay? They consider you sick if you have some kind of symptom or if you have some kind of test that comes back positive. And at that time, you're given a diagnosis, and that particular diagnosis is prescribed to a particular treatment. It doesn't really take into effect the cause. It doesn't really take into effect the person that's sitting there. There's a specific treatment, usually a drug or a surgical procedure, that is assigned to that particular diagnosis. Now, a lot of people think that natural medicine is that exact same type of philosophy, only that we have safer solutions. Well, what I am here to tell you, and what I educate all my patients on, is that rather than being like this, there's actually a huge gray area between wellness and sickness, okay? And what's happening in that gray area as your body starts to pull away from its best health are things that people think are normal aging. And a lot of these things people think they're normal because they're common. We're talking about things like more allergies, digestive issues, aches, pains, fatigue. Fatigue is a big one. People just tend to think that it's just normal to not have enough energy to get through a day. And so all of these symptoms, all of these areas. Now, a lot of times when you fall in this gray area, you'll go to your doctor and you'll tell them you don't quite feel well. You feel like something is wrong. And what do? They do all the tests. They do the physical. And they tell you, well, all of your tests are fine. Your blood work looks good. In a lot of cases, they'll prescribe you an antidepressant or something like that and send you on your way. Well, what we do is we look for all of the actual underlying causes of the reasons why you're not feeling your best, in your best health. And so I work to optimize energy, vitality, and wellness. And what I do is look for the things that will start to pull you away. So this can involve lifestyle factors, okay? We all know that our lives can be stressful. We're looking at things such as sleep, the amount of exercise you're getting, whether or not you're sedentary, whether or not you're moving your body, because the body actually needs motion. We're looking at physical stress. Now, physical stress can come in the form of things that you would traditionally think of as healthy. It can be exercising too much. In certain cases, aggressive exercise can be, imbalancing to the body, and it can be too much. This can be something like a scar or an old surgery that you had. Sometimes scars actually affect your nervous system and can throw your health off for years to come, and people just don't know this. It can be dental work that you've had. There's several different things that could be a physical stress that you may not ever think of. We all know now that mental stress has a huge impact on the body. As a matter of fact, WebMD reports that mental stress is at the underlying cause of 75 to 90% of all doctor's visits. They all have that stress component. And so looking at what the stressors are in your life and how you can work to balance that. And then the big one, the one that I love to work with because it's not typically looked at in medicine, is toxins. We live in an increasingly toxic environment. We have so many toxins in our foods. The pesticide use is just outrageous. If you look at glyphosate, just one of the many pesticides that's used, it's being found in so many foods now, and it is so toxic to our nervous system. And so we're looking at the toxicity levels. We're looking at the chemical toxicity. We are in a society that's inundated with chemicals. The chemical use is at an all-time high. From the time we wake up until the time we go to bed, we are exposed to chemicals. They're in the carpets, they're in our furnitures, they're in our clothes, they're in our air. I have talked about air fresheners because that is a huge source of indoor air pollution. These things actually affect our hormones. They imbalance our hormones, cause us to be inflamed and fat and tired and all of these things. And so these are some of the things that I will look at. I will look at heavy metal toxicity. This is another big one. And this does not show up on blood work. There are specific tests. I use a hair tissue mineral analysis to determine this, but I also test energetically, and I'll get to that in a minute. We are talking about things like old shots that you may have had that are leaving toxins in your body, fillings that you may have had, getting your house sprayed for bugs, these pesticides, not eating organic foods. These are all areas where we're getting toxins into our bodies. And I'm not saying that you can live in a 100% toxin-free environment. That's impossible. But what you can do is compensate for that by giving your body the tools that it needs to work with that and to detoxify. Another big challenge is immune challenges, viruses, bacteria, mold and fungus, parasites. I hate to admit it, but this is a very common problem, and it's nothing to be ashamed of. It's very common. Once we figure out that it's there, we can figure out the solution. And so the body is energetic. I have this little energy stick just to demonstrate. It's actually a little capacitor, and if I hold it on both ends, it lights up, because our body is energy. And so I can actually test energetically by using frequencies of different things. So I have these little vials here, and they are frequency preparations of different things. So plastics, for instance, dioxin, which is a big toxin that's found as a byproduct of bleaching. It's found in tampons and sanitary napkins. I have radiation, EMFs, food chemicals, mold, MSG, estrogen overloads from our environment. So many different things that you would never know can actually be affecting your health. And I can actually test for these energetically here in the office. So that is all part of what I do. And I just want to tell you the 6 fundamental principles of naturopathy. So the first one is to trust the body's inherent wisdom to heal. Your body has an amazing ability to heal. Trust it. We were meant to live on nutrition. We were not meant to live on pharmaceutical drugs and chemicals. And the majority of the vitamins that you find on the shelf, like a one-a-day type of vitamin, are all synthetic. They are chemicals created in a lab, oftentimes by the drug companies. And so you have to have good supplements. You have to have whole food supplements. You have to have supplements that come from the earth and that have all of the healing properties that we were designed to use. We were designed to use foods and herbs and things like that. And so that's the number one thing. The second thing is to identify and treat the cause. We need to be looking beyond symptoms. We're not just trying to, in chiropractic school, we called it hyper the hypo and hypo the hyper. We're not just trying to take a symptom in the opposite direction. We're trying to find out why the body is creating the symptom, why it is trying to compensate. And usually this is some specific form of assault, whether it be physical, whether it be emotional, whether it be chemical in terms of toxicity or nutrition. So once we find that, we can remove the cause and allow the body to heal. And this is why natural medicine gets such amazing results, because instead of trying to cover up what's going wrong, we actually get to the root of the problem. The next tenet is to first do no harm. Now, this is part of the Hippocratic Oath. All licensed doctors of all kinds take this oath. However, in a lot of cases nowadays, it's becoming more like the hypocritical oath. And so we want to prescribe to that first do no harm, and we want to look for ways to heal and balance the body without creating more harm. Now, a lot of times, I'm not going to say medicines are not necessary for some people. They are sometimes, especially when something has gone for too long. But we also know that they all come with major and minor side effects. And so our goal should be to move the body to a place where that is no longer needed, where true healing has taken place, and where you can support your body with good nutrition. Next, doctor as teacher. This is powerful because I truly believe that when people understand why they need to make the changes, they will make them. And so I spend time, and my visits are long because I spend time educating and empowering people to make better choices for better health. And that's really what it's all about, education. And even in the evenings, I spend time on a sound the alarm campaign, because I truly believe that when people understand what the problems are and the way that we got here, we can truly make a difference and make some changes, and it can be beneficial for themselves and also for their entire family. Treating the whole person. Okay, I've run into so many people that have been ingrained in the medical model, and they have their foot doctor and their diabetes doctor and their liver doctor and their eye doctor and and none of these doctors are working together. Well, I have news for you. All these parts are connected, and they all influence each other. And so when I test, I look for all of the areas that are challenged, and then I ask the body, what is the priority? Where do we need to start? And what I often find is that when we handle the priority and when we handle the priority stressor, all those other things fall in line because they're all related. None of it happens in a vacuum. And so treating the body as a whole. And then finally, prevention. Prevention is truly key. The same things that cure and mitigate disease also prevent. And so for me, myself, I've never had a major illness or injury. And I will take supplementation and go to naturopathic doctors and chiropractors for the rest of my life, because I don't want to go down the same road that so many people are going down. Our healthcare right now in America is deplorable. The statistics that I've been sharing are just outrageous. 41% increase in heart disease, a 50% increase in childhood allergies, a 50% increase in irritable bowel and all the digestive issues, a 4,200% increase in autism. We're going in the wrong direction. 103 million Americans with high blood pressure, 4 out of 10 Americans obese. I'm going to be proactive, and I'm going to work on prevention. And this is the naturopathic model. So thank you for joining me today. I hope you have gotten value from this video. I appreciate all of you who are joining me live, and I truly appreciate all of you who care enough to share. If you need specific help with a health challenge that you have, please reach out to me. I do see people locally in Atlanta, Georgia, and also remotely, and get great results both ways. So either way, we can work something out. But I truly hope that you will all listen, take heed, and make better choices for better health. Thank you so much, and enjoy the rest of your Wednesday.